Hello everyone, you are all welcome to lecture number 1320 and today's topic is calcification of the heart is having high risk of heart attack or even heart failure. Calcification means deposit of calcium around the heart inside the arteries wall, and that is responsible of making the passage of the blood difficult, and it makes narrow passage, and also the deposit of calcium in excess around the heart is responsible of damaging the heart valve. And to my understanding, this calcification is mainly responsible of damaging the valve, aortic valve, from where your blood is pumped out. And once there is serious deposit of calcification, there is no option except to change the valve. And I will not hesitate to say that 100%, forget about 90 or 99, 100% valve damage where people are going for surgery to replace the heart valve is due to chronic calcification of the heart, and with that calcification, deposit of calcium, this valve will be completely damaged. And if we can say if it is not taken care of intake of calcium as a dietary source or lifestyle or maintaining some of the factors and causes, in the long run either your valve will be completely damaged or even your heart muscle failure will be there if it is always under the cover of this calcium. Let me show you the image. Here you can see chronic calcification of your heart, and you can see the yellow deposit around the cardiac muscles, and that heavy deposit of calcium around the cardiac muscles is enough to damage cardiac muscles, and it may cause heart failure. Also, you can see in the arteries inner wall, there is chronic deposition of calcium. It means it has undergone calcification and it has become narrow. And the other one you can see it is normal without calcification. And here you can see also that the valves, they are also covered with the coating or deposit of calcium. And once there is chronic deposition of calcium, your valve is completely damaged and there is no alternative except to get it replaced by surgery. This is totally damaged heart valve where lot of calcification is there, means heavy deposit of calcium is there, and this valve is totally dead. Only option to go for surgery to replace the valve. That is chronic condition. So if any cardiac patient is having either heart failure or valve damage, is because of chronic calcification. And you should understand that heart failure and heart attack, there is a difference. Heart failure means where your heart muscles are damaged, they are non-functional, and that is mainly caused by either calcification or some other viral or bacterial infection. But in most of the cases, it is due to chronic calcification, calcium deposit, and even valve also. Valve, we can say 90-100% is because of calcium deposit it is damaged. So there is difference in heart failure and heart attack. Heart attack means where your heart muscles, they are not getting enough oxygen due to blood supply. That's why the heart muscles are sinking and they stop working and you will get heart attack. So that is because there is blockage and blood supply is there. But in the case of heart failure, it is because of heart muscles weakness or damage. So I have given some of the factors, causes, diagnosis, treatment, and how to reduce the risk factor. So here, A, calcification of heart can be dangerous condition and that increases the risk of heart attack and damage the heart valves. Causes of calcification. What are the main causes of calcium deposit, that is called calcification? Number one, that is aging process. Once you are aged, slowly in 60, 70 years of age, there will be deposit of calcium where your arteries, veins will become narrow. Second is high blood pressure is also increasing calcium deposit. Then those who are diabetic, where sugar is high in blood. Then high cholesterol. Also those who are having high cholesterol level means there is increased risk of calcification, calcium deposit. And dietary source. Sometimes you are taking such type of vegetable or fruits which are very rich in calcium, like avocado, spinach, and some other fermented material like dairy product, milk, yogurt. Of course, in moderation. That's why it is very important to say balanced diet. Excess of anything and everything is bad. So it can be, if you are taking in excess, definitely you are pumping more and more calcium, and once more and more calcium is going, and if suppose you are taking more and more vitamin D, so vitamin D will facilitate the absorption of calcium, will increase the absorption of calcium, and in that case there will be maximum chance of calcification around the heart, around the arteries. So dietary source, that is dairy products, fortified foods where already they add some more extra calcium. Then excess calcium supplement, I have already told you if you are taking excess sometimes. That's why I am always saying, for example, I am lecturing, this is all medicinal chemistry. Of course, without chemistry, medicinal chemistry, drug chemistry, we cannot proceed because all the health conditions are around that. We have to understand the oxidation, reduction, free radical reaction mechanism. But at the same time, you must consult doctor before going for any type of supplement or drug, because only clinical doctors, they understand very well whether you are taking extra or it is required or not. Some people, because of window medicine, window habit, they will think that if you will take extra calcium, we will take extra vitamin D, then our arthritis, rheumatoid arthritis, all the ligament and everything will be very, very strong, is wrong. For everything, it has to be balanced. So don't go for window medication, self-medication, unless it is consulted by senior doctor, consultant, and as per his prescription, then you should follow. That's why many people, they become victim, supplement, and then excess vitamin D, I have already told you. Then also oxidative stress and chronic inflammation. My all work, I have published 70 research papers on chronic inflammation and oxidative stress, antioxidants, and lot of phenolic compounds, how they are taking part in our oxidative stress reduction and reducing the inflammation. and your all health condition, once you exclude bacteria, virus, is all around free radical, antioxidant and anti-inflammatory compounds. Then B, diagnosis and treatment, symptoms. So diagnosis, there are two ways. First is that is sonography, that we call it echocardiogram. Echocardiogram will tell about the condition of calcification, and second is that is your angiogram. With that it will be clear the calcification. And then symptoms, there are symptoms like chest pain, shortening of the breath, palpitation and swollen eggs. Actually, we should have the practice like that once we are normal, we are not going for this angiography. It's better to get it done so that at least the status of all those things, blockage, calcification, will be clear. So that if you have such type of condition, at least you can take care. Just like in previous lecture I have mentioned, nobody is going for lipoprotein A, LP small a test. And that is the hidden cause of heart attack in youngsters, teenagers, young. Because lipoprotein deposit percentage is from childhood. If it is high, it will remain high up to death. So in the same way, calcification after some age, 60 or 50, no harm to go for angiography to know, by knowing the angiogram or echocardiogram, that what is the condition of calcium deposit, and then how will you reduce the risk of calcification. For a lot of health condition to reduce, first condition, take enough water. Hydration of your body is first thing, because most of us, when we are thirsty, we are dehydrated, we are confused with thirst, that no, we are thirsty. No, it's not like that. Especially in Maiduguri, always keep one bottle of water with you, and after every 15-20 minute time duration, gap of time, you take some water. Always be hydrated. So take enough drinking water, take balanced diet, means it should not be junk, anything in any quantity. No, it should be balanced, like calcium, vitamin D, antioxidant, anti-inflammatory compounds, and all other mineral, vitamin A, vitamin C, citrus fruit, lemon, lycopene like tomatoes, all mixed vegetable and fruit, and in general 80% fruit and vegetable and 20% animal product. Then stay hydrated. Regular exercise is very important, and then you have to manage all type of stress. One is called oxidative stress, second is called general stress, always in tension, chasing this and that. No. Let us have simple life, happy life. Whatever you are getting out of your skill and hard work, you should be thankful to Allah, God or nature, whatever you believe. So this is what about the calcium deposit, calcification, and its high risk of heart failure, heart attack, and 100% that is wall damage to go for surgery. So with this I will stop. Thank you very much for watching the lecture.